Hi, and welcome to Pregnancy Glow. If you're here for the first time, don't forget to subscribe so you never miss the support and guidance you deserve on this beautiful journey to motherhood. Spotting or bleeding at any point during pregnancy can feel really scary. Especially in early pregnancy, even a small amount of blood can make your heart race with worry. The first thought that comes to mind for many women is, am I having a miscarriage? But I want you to pause, take a deep breath, and know this: you are not alone. Spotting in early pregnancy is more common than you might think, and it doesn't always mean that something is wrong. In today's video, I'm going to talk to you about what spotting actually is, why it can happen, what it might look like, and when it's time to call your doctor. Let's start with, what is spotting? Spotting means light bleeding, just a few drops or small stains of blood. It's not like a period. It's usually lighter in color and quantity. It might look pink, brown, or even red, and often it shows up when you wipe or as a little stain in your underwear. It can last for a few hours or even a couple of days. Now, why does spotting happen? One of the most common reasons is implantation bleeding. This happens when the fertilized egg attaches to the lining of your uterus. That tiny process can cause a little bleeding, and it usually happens around 6 to 12 days after ovulation. Some women even mistake it for the beginning of their period. Another reason is hormonal changes. Your body is adjusting to a surge in pregnancy hormones, and that shift can sometimes lead to light spotting, especially in the early weeks when your body is still figuring things out. Then there's cervical sensitivity. During pregnancy, the cervix becomes more sensitive due to increased blood flow. So things like a vaginal exam, a pap smear, or even sex can cause some spotting. It might look a little alarming, but in most cases, it's totally harmless. Sometimes there may be cervical polyps, harmless growths that can bleed easily during pregnancy. They're usually not a cause for concern, but your doctor can let you know for sure. But I also want to be honest with you. Not all spotting is harmless. In some cases, it can be a sign of something more serious, like a miscarriage or an ectopic pregnancy. If the bleeding becomes heavy, like a period, or if you have strong cramps, especially sharp pain on one side, or feel faint or dizzy, those are red flags. In those situations, you should contact your doctor or go to the emergency room right away. One condition to be aware of is ectopic pregnancy, when the pregnancy implants outside the uterus, usually in a fallopian tube. It can be dangerous if not treated quickly, so if you feel intense pain or feel like you might pass out, please don't wait. Seek help immediately. I want to talk about something really important now, the emotional side. I know how easy it is to panic. The moment you see that spot of blood, your mind goes into overdrive. You start worrying if you did something wrong. Maybe you lifted something heavy. Maybe you were too stressed. Maybe you overworked yourself. But please, don't blame yourself. Most of the time, spotting is not something you can control. Your body is going through enormous changes. You are growing life. And sometimes little things just happen. It doesn't mean you failed, and it doesn't mean something bad will happen. So what should you do if you notice spotting? First, rest. Give your body a break. Lie down, put your feet up, and just breathe. Avoid any heavy lifting or intense activity for a little while. Second, track what you see. Note the color, how much blood there is, and if you feel any other symptoms like cramping, pain, dizziness, or fever. Write it down. It helps your doctor understand what might be going on. And third, don't hesitate to call your doctor. You're not being dramatic. You're being careful. And that's exactly what you should be. Even if it turns out to be nothing, it's better to check and have peace of mind. Pregnancy is a beautiful journey, but it's also full of moments that test your strength. You're doing so well, even if it doesn't feel like it. You're listening to your body, asking questions, and seeking answers. That's what a strong mom does. If this video gave you even a little comfort, please give it a thumbs up. And don't forget to subscribe to Pregnancy Glow for more support, answers, and real talk, because you deserve to feel informed and empowered every step of the way. Take care of yourself, be kind to your body, you've got this, and I'll see you in the next video.